And since we got the whole country here, shall we get started?
Absolutely.
Fantastic. So everybody, welcome to Health and Wellness Coaching for Shift Workers. Today we will explore key differences for the shift worker population, 3 factors preventing them from making healthy changes, and tips on creating an inclusive health and wellness plan. By attending today, you will earn 1 continuing education credit approved by the National Board for Health and Wellness Coaching. At the end, I will post a link in the chat box to get your continuing education credit at the end of today, right? But speaking of chat boxes, we also have a Q&A feature in this webinar, and we will have a Q&A towards the end. So please use that Q&A feature to submit your questions. Otherwise, the chat box is there. Brief introduction. In case you don't know me, my name is Brittany Kowalski, as it says here in the line below my face. I am a nationally board certified health and wellness coach with Avedon Health. Avedon was launched in 2020 following MedPro Wellness's acquisition of Self Help Works. And so Avedon Health is a team of behavior change experts who are passionate about providing health strategies that empower people to make positive life changes. And what I love about it is that we focus on the individual, not just the condition. And we do that by using innovative engagement technology, impactful courses and content, and care team support to help drive meaningful outcomes at scale. And our mission, we have socks that say it, true story, is to change lives, right? We're here to change lives by fixing the engagement problem in healthcare. And myself and Avedon Health, we are so excited to partner with Laura Timbrook today to bring you this phenomenal and much needed information. But please note this event is purely educational. It's not medical advice, does not reflect the views of Avedon Health. But now on to Laura, the expert. Laura is a nationally board certified health and wellness coach, an international speaker, and a well-being strategist in the manufacturing industry. She's also the host of podcasts Outspoken Nutrition, as you see behind her, and Manufacturing Wellness. So with that, let's give Laura a warm virtual welcome.
Woo! Very cool. Thank you so much. And everybody, I want you to open those chat windows if you don't have them open, because we're going to be utilizing them through this presentation. So without further ado, I'll go ahead and let me just share my screen. Okay. And now you guys, if you see me, oops, first of all, I have to apologize for saying you guys. I will try to watch my pronouns. I'm just used to dealing, hold on, let me move this over here, dealing in the manufacturing industry, and most of it is male dominated. So if I say it, I apologize, and I'm going to try to correct myself. But, you know, this is so important for me. And I am so thankful for Avedon Health for giving me this opportunity to really share why this is so important and what we need to do. My name is Laura Timbrook. I am a well-being strategist for the manufacturing industry. I also host the podcast. The most popular one is Outspoken Nutrition. And some contact information, please reach out on social media, say hi. I love to hear what you're doing, where you're from. I think the fact that as health coaches, we can have this amazing community where we can really change lives is so important. So if you love what you do as a health coach, I want you to go into the chat and give me a big hell yeah. I want to see, let's get this chat moving. I want, you know, us interacting, because this is what we're here to do. We're here to make changes. Hell yeah. There were, hell yeah. I knew somebody would do it. That's awesome. So I absolutely love this. You know, one of the things when I decided to sit for my national board was really this one part of a sentence that really called to me. And it was well-being through self-directed, lasting changes aligned with their values. You know, so many times, all of a sudden now, we're working in conjunction with our clients. And this is really what I've learned so much in my career. So little bit about me, I've spent about 10 years in corporate health and wellness. And I loved everything I did, whether I was making smoothies, I was doing big seminars or workshops, or I was doing health coaching at the end of, their biometric sessions. I loved everything, but my life really changed when I stepped into manufacturing and really working with shift workers from our manufacturing and transportation to our police officers and first responders has really kind of been where the last several years have been living. And today we're going to talk about why shift work is so important and why we need to be making sure that us as health coaches, we're inclusive. Now, how many of you in the past have worked? Actually, I think we might have a poll up. Brittany, do we have that poll? So I want to know how many of you have actually worked in corporate wellness or want to work in corporate wellness, just so I have a general understanding. Okay, so it seems like a lot of you have worked in corporate wellness, and this is perfect. And some of you want to. And again, this is going to be exactly what we want there. So this is actually great to see. I actually love this. All right, cool. So we have a majority of us have actually worked in corporate wellness, and that's key to what we're going to be talking about here. So let me just move this off to the side. Okay, cool. So what is shift work? So as we're talking about shift work, we need to understand exactly what shift work is. So shift work is referring to shifts performed in a rotation. It's generally a company that operates within 24 hours. So they need somebody working the morning and they need somebody working late at night and everywhere in between. And, shift work, when we talk about shift work, we talk about a couple different shifts. We have our day shift, which is also known as your first shift. And this is typically your 9 to 5. Then we have our swing shift, and it's literally the shift that swings between day shift and night shift. And they usually begin around mid-afternoon and they run to about midnight. And then we have our third shift or our night shift, our graveyard shift. And these are the ones that are working overnight, starting at midnight and going into the morning. And then we have something called rotating shifts and split shifts. So a rotating shift will rotate through a pattern, some type of pattern between the different shifts. Most oftenly, they'll get a couple day shifts, a couple swing shifts, a couple night shifts, and then they'll get days off in between so that they're supposed to, my air quotes here, supposed to be able to realign their circadian rhythm. But as health coaches, we know that's often very difficult and you can't just do it on the fly. And then we have split shift. And then a lot of times this is within our first responders field or our nurses field, where they'll work like 4 hours in the morning shift and 4 hours in the swing shift or night shift and morning shift. So it's really splitting it up. And while we're splitting our work up during the day, doesn't mean our brains are necessarily resetting. So a lot of times I see those that work in split shifts, they feel like they're working 16-hour shifts, even though they might get time off in between. It doesn't really feel that way because they're just waiting for a next couple hours to go back in. So it becomes very difficult. Now, in the chat box, let me know if you have worked in a shift work industry, if your family has worked in the shift work industry. So let me see how many of you have dealt with understanding some of the complexities to having shift work either for yourself or your families. Okay, so we've had, people 22 years. Absolutely. So we do have a second and third shift. That's a rough one. Husband works graveyard, military. Yep. Okay. So we have a lot of people. So this is going to make a lot of sense to a lot of you. Husband's a firefighter. Absolutely. For those of you that are in the military, I just want to take a moment and thank you for your service, for you, your family. So that's important. And yeah, absolutely. It's really kind of amazing when we start looking at shift work. I know when I originally started, especially I started in manufacturing, I really just kind of thought it was like a manufacturing transportation thing. And then I started looking further and realized, no, our doctors, our nurses, our first responders, they are all our shift working professionals. It's not just somebody who joins a manufacturing business and they're thrown in on the third shift because it's the hardest shift to fill. And then some family dynamics require a husband or a wife or a spouse or a partner to work that night shift because of kids or scheduling. So it's really a career for a lot of people. And it's important that we are embracing that. And as health coaches, we are supporting them in their health journeys. You know, let's just talk about some statistics for a minute, because I know so many of you work in corporate health and wellness. So a lot of these are going to be somewhat familiar to you. But the crazy thing is how much it increases when we start talking about our shift working professionals. So we know for cardiovascular issues, there is a 40% increase among our shift workers. You know, we all know. How many of you know that in the work you do, sleep is always an issue? Give me a hell yeah if sleep is an issue with a lot of your clients. Always. Yep. Yep. Exactly. But now think about a shift worker. They generally will get 2 to 4 hours of sleep less than the normal. And I can tell you from my experience in manufacturing, 4, maybe 5 hours is the most we get. It's scary because a lot of for my clients is they're operating heavy machinery and not sleeping. This is really scary because we know that getting 20 hours let's restate that. If we are awake for 20 hours, we have the cognitive function of somebody who is legally drunk. And I know I am working with an ER vet right now, and she sleeps 5 hours every 36 hours. She is in high demand and she's not able to get the sleep that she needs. It's serious. You know, we know from the medical industry, I recently just took a course on from OSHA on nurses. And I know we had a couple nurses in here, and how important. I was just reading a study that there is a 53% increase in medical mistakes due to lack of sleep. And there's so much more coming out about it. We know how important sleep is. So whether we're trying to save someone's life, we're driving a several ton truck, or we're working around with a skid steer among a whole bunch of employees, we need to be making sure we're getting proper sleep. You know, within shift working, rotating shift working specifically, there is up to a 60% increase in diabetes. That's insane because a lot of our manufacturing workers, our nurses, they have been doing this for 20, 30 years, and that's increasing their risk of diabetes. This is really serious. And now back in 2007, the WHO, so the World Health Organization, listed shift work as a probable human carcinogen. So they're seeing a link between shift work and cancer. So as much as we have spent in the corporate industry, we need to take that forward to the next step and really start focusing on our shift working professionals. So what are some of the key differences when we talk about our typical someone that works 9 to 5 versus someone that rotates on a shift or works a swing shift or the night shift? Well, there's a few key differences we're going to talk about. One, their schedules are unique. They don't wake up at 6 o'clock in the morning, have breakfast by 8. They're not on our typical schedule that a lot of us that don't work this are on. And their time is critical, whether they're trying to find time to sleep or go to the doctors. Time for them is always critical. They can never find enough time in the day. And I know so many of us can't find time in the day. And we know at a certain time we can go to bed on an average every night. But those of us that work in shift work or have friends or family that work in shift work, we understand this. I mean, even think of something as simple as a birthday party. Let's say you have a Saturday afternoon, noon birthday party for a kid. If you're working a third shift, noon on a Saturday morning is really difficult. because for you, you're not quite upright. You need that sleep. And the biggest thing is when we talk about shift work, they have the highest rates of diseases amongst any other professional. It's amazing. I was doing some research specifically in manufacturing. And I was like, who has the highest diabetes? Who has this? It was always transportation, nursing, or manufacturing was always the three. And if you look at it, they're all want careers that work on shifts. So we need to be focusing them and getting those health and wellnesses in check. And I really believe we are excluding shift working professionals from the health and wellness conversation. And I'm going to share with you a little story on how this all came to me. So I was working in corporate health and wellness, and one time I was sent to a paper mill plant. And this is your old school manufacturing plant. There is no front end office. I actually had to find out where I was going by going through the diesel mechanic shop. And I sat at the end of the health fair doing my health coaching, and someone finally came up to me, because let me tell you, no one was coming to talk to me. First of all, I think I was the only girl in the whole company. And they all just kind of walked past me. And finally, some gentleman sat down with me. And he says, I don't want to be rude. He goes, but healthy doesn't work for me. And that kind of took me back, because as health coaches, what do you mean healthy doesn't work for you? Healthy works for everybody. How many of you here really believe that healthy works for everybody and everybody has the opportunity to be healthy? And if they don't, they at least should. Throw it in the chat for me. Yes, absolutely. And this is what came out of our conversation, and the hundreds of corporations and manufacturing and first responders I've coached since. It's always similar in responses. So let's talk a little bit about why healthy doesn't work for them. Well, the first thing is, how many of you that have done done corporate wellness? I know this is probably going back a little bit. How many of you have presented on the 10 p.m. club? I know when I first started, 10 p.m. club was like the common one. 10 p.m. club, sugar shocker. You were presenting on, getting sleep and going to sleep on time. Anybody present? So throw it in the chat. Yep. Okay. So the 10 p.m. club was really about getting people to sleep their 8 hours a night. The problem is we created the 10 p.m. club, and there is a whole bunch of people that going to sleep at 10 p.m. is not physically possible. And in this example, when this guy was talking to me, actually a few months before I came there, they actually had some of the corporate people come into the office, and then they wanted the plant employees in the conference room as well. And they presented on the 10 p.m. club. Let me tell you, that went over really well when you had a room of second and third shift workers who actually stayed late of their shift so they can attend something that totally didn't relate to them. How would you feel? Let me know in the comments. How would you feel if you stayed late at work to be presented with something that didn't include you? So tone deaf, absolutely, completely tone deaf. And this is kind of what's happening with the shift work industry. We talk about fitness and the importance of going to the gym, but imagine being on your feet all day long and now having to go climb a Stairmaster at the gym. That is not what a nurse wants to do when she has been on her feet all day. When we talk about going to the doctors, it's really important in a lot of shift working that they're not getting to the doctors. They're not getting those biometrics done. And the reason why they don't want to go to the doctor is sometimes they feel that their job is at risk, because a lot of times our shift workers, they're physically demanding. So there is this ongoing fear that if I go to the doctors, if they find something wrong with me, I'm going to lose their job. But beyond that, we have the biggest issue that they can't make a doctor's appointment. Right now, have any of you in the last 6 months had to make a doctor's appointment? Let me know in the comments. Because making a doctor's appointment right now is taking months to be seen. Now imagine you don't really know what your schedule is going to be because you're waiting on your manager to find your schedule. Well, and then you got to make a doctor's appointment. That's difficult. And then a lot of times our shift workers are sleeping when doctors' offices are opening. So one of the biggest growing things is getting those health fairs into these organizations, whether it's bringing it into a police station or the hospitals. So making sure that they have the opportunity to get their biometrics done so that they understand their numbers, they understand their blood pressure and their blood sugar, because it's important. Then we talk about stress management. This is another hot topic right now in corporate wellness, is stress management. But now talk to that about somebody who has no time in the day, who maybe hasn't seen their kids all week because they work a night shift. And now we're telling them they need to take 20 minutes to go meditate and go do this. It doesn't include them in the conversation. Not that any of this is not important. It's just that they don't feel how this can include them in the conversation. And one of the biggest things I realized on why we are missing the point is when it comes to lunch. How many of you, when you talk to your clients, talk about, tell me what you had for breakfast, lunch, and dinner? Anybody ever use those terms? Let me know about your meal times, breakfast, lunch, and dinner. It's generally always, for a shift worker, breakfast, lunch, and dinner is confusing because they can't associate it. Because if you're waking up at 5 p.m., well, is it breakfast or is it dinner? Like, what is it considered? And for a lot of times when we would talk to our shift workers in these health fairs and stuff like that, we would tell them, oh, well, just flip your meal times around. We're making them do the work. We're not working with them. We're not supporting them. So we need to change our conversation with them so that they understand and they are supported and they feel like they're part of the conversation. So let's talk about some key factors now that are preventing them to make the changes. We know what their reasons are, right? But let's talk about this. Well, it comes really down to 3 simple factors. One is their availability. Can they go to the doctors? Can they even follow a doctor's recommendation? And how do they spend time with friends and family? How do they build those relationships? We know how important relationships play into our overall health. How many of you have talked to your clients about how important relationships are into their overall health? It is so important. Absolutely. Yes, it's very important, but yet they can't figure out how the time is to be, how to even have that time. The next thing we have is the healthy lifestyle options. Meal timing. How do they time meals? How do they even prep for meals? How do they pack a lunch that they might not have a refrigerator to put it in? How do they find time to exercise? What exercise is right for them when they've been standing on their feet? And stress management, how can they include that into their health? Because they don't have the time, or maybe they don't want to sit in a meditation state. Maybe it's not them. How can we continue having this conversation and including them? You know, one of the things I found when it came to intermittent fasting within manufacturing, it took off. One of the reasons why, and it wasn't so much intermittent fasting itself, it was the fact that it became as simple as I can eat at these hours and I don't eat at these hours. Suddenly we threw meals out the window. It was feeding time. They didn't have to worry about am I eating breakfast at 8 o'clock at night, or is it considered dinner because kind of eating dinner with the family so it feels like dinner. All of that was no longer a problem. It was just feeding time. And this is where we really saw, I started working with my manufacturings with stress management using fishing. Because you know what you do when you get to the pond or the lake and you go to cast your reel? You know, the first thing somebody does? That fresh air. And what do we talk about when we talk about mindfulness and meditation is having that deep breath, smelling the air, feeling what's going on. They are being present. And it doesn't require a yoga mat or twinkle lights, as some guy told me one time. It's a way that we can transform these healthy options. And then the routine sleep schedule. This is difficult because it's really hard for somebody that works on a shift to find 7 to 8 hours of restorative sleep. You know, when we talk about poor sleep hygiene, we're really talking about two ends. We are the circadian rhythm, and then we have sleep pressure. And sleep pressure is really getting ourselves good and tired, putting that environment in place and going to sleep. Now, trying to change the circadian rhythm for a shift worker, it's going to be really difficult. But one of the things we can do is we can help build better sleep pressure. And how can they make a better sleep environment? Dark out shades, blue light glasses, making sure they have the proper blue light glasses. Any of us here wear blue light glasses? I actually have a pair. I know, Brittany, you have the pair on you. Well, one of the things is really when we're talking about manufacturing, we want the yellow blue light glasses because it blocks more blue light. Because blue light, when somebody is driving home, we need to be careful of it because that's going to reset our circadian rhythm. So we want to make sure that we're wearing the right ones. Never heard of that. You're welcome, Kelly. And, you know, all of this is really important. And it's about changing that conversation because for any of us that work 9 to 5, we don't really have to worry about the blue light at home. I mean, we should limit our devices, make sure it's on the blue blocker on our phone and everything like that. But you know, we don't really worry about the daylight too much, but yet for someone on a shift work, we have to be mindful of the daylight. You know, it's kind of amazing. They have cared so much for us during this time. The last 18 months has been really, really difficult. Our first responders, our medical personnel, our essential workers have made sure we have been healthy, made sure we have been safe, made sure that we had the proper PPE, and they've been working their tails off. We even saw distilleries changing over from vodka to hand sanitizer. It's so important as health coaches that we start returning the favor and including them within that conversation. So now we're going to start talking about how we do it. So we want to start by creating that inclusive wellness plan. Now I'm going to tell you about another story. So when I was in another manufacturing facility, I realized that a lot of their staff wasn't eating lunch. And I couldn't understand why. They all had health issues, but lunches it was always being skipped. And finally, I was talking to one of the fellas and he told me, so the facility they worked in, they had to wear coveralls. And for them to leave the plant floor, they had to take the coveralls off. Now, any of you ever tried to lace up a 9-hole steel toe boot? Let me know if you've ever worn a pair of Doc Martens, hell, even a pair of hiking boots, and how long it takes them to it takes a while compared to a shoe you just slip on and off. Now, imagine every time you go to lunch. Now, shift workers, nurses, barely ever get a lunch. Manufacturing gets 30 minutes. Within that 30 minutes, he has to unlace his boots. Now, mind you, he already has mobility and weight problems. He has to unlace his boots, take off this coverall, put the boots back on, walk to the dining room because it's not in the same building. So he has to go outside, go to the building, and then you wait in line for the 3 microwaves to heat your lunch. It was physically impossible for anybody to have lunch and do that. Because even if he had no mobility issues, even if he could whip on those shoes on and off, when he would get to the lunchroom and wait the 5 minutes to heat up his food and then take the 2 minutes to heat up his food, he would have no time to eat his food before he started to have to go back and redress. Now, I know the simple solution would have been, well, longer lunch breaks. The problem is they were union, so they got 30 minutes. So it wasn't as simple as the organization saying, hey, we're going to give you a longer lunch hour. So we had to really think outside the box. And this is really what has taught me to create this inclusive wellness program. We need to listen and understand. Find out what's going on. What are their troubles? Next thing we want to do is create a flexible wellness program. And flexible is key. And then we want to stick to items that are familiar and easily accessible, because we don't want them to have to think anymore about it. So let's take a little bit dive deeper. You know, I know how many of you, when you sat for the national board exam, there was that question on the test. I think it was called, if I'm going to remember this correctly, and someone correct me if I'm wrong, I think it was on motivational interviewing, where it was asking you that you were to ask your client, what would happen if they didn't make the change in 5 years? Any of you remember that question from your training or your exam? Let me know in the chat if you remember that question. But one of the things I found out when I started coaching my people is it was so much more of what I didn't say than what I did say. We have this amazing, powerful, and transformative tool. And the tool is simply listening. I can't tell you how many times I've had people tell me they're not ready to make a health change. I know you guys have dealt with that before. When you have a person down, they want the health change, but they really don't want to put the effort into making the health change. So one of the things I have learned from our training is asking them, what would it look like? I had a guy one time, had high blood, he was pre-diabetic. The nurses already talked to him. We were trying to create a plan forward, and he wanted nothing of it. And he told me, and I asked him that question, what would happen in 5 years if he didn't make that change? And he's like, well, he goes, diabetes runs in my family. I'll probably lose a toe. I'll probably get heart disease, and I'll probably die early, just like my mother. And I was silent for a moment, and I said, let me just get this straight. You're telling me, you know, if you don't make this change right now, that in 5 years, you're probably going to lose a toe, you're going to have heart disease, and you're going to die early because you don't want to manage your blood sugar now? And then I was silent. And I could feel that turning in his head. And he looked at me and said, all right, tell me one thing I can do. The conversation changed just with that. So our ability to listen to their complaints, to understand why they know they need to make a health change, because that is one of the biggest things I've learned. And I'm sure most of you realize, and if you do, give me a hell yeah in the comments. But that's one of the biggest things I've noticed. Most people I coach know what they need to do. They just either don't have the motivation to do it, or quite frankly, don't want to do it. But they know. And that's where we need to work with them and listen and find out their struggles. Seek to understand. Absolutely, Marie, absolutely. Because that is so powerful for us. The next one we talk about is creating that flexible wellness program. And really why this needs to be flexible is because a lot of times they don't understand their schedules, or they know their schedules are crazy. So we need to create a wellness plan that can be flexible, that when they have to work the day shift, they know how to easily change it. If they have to work the night shift, what it's going to look like. Kind of that idea of going from meals to feeding time, because now it doesn't matter what time breakfast is. They know when they're hungry, they eat. Creating that flexible program. If they can't get to the lunchroom and they can't eat a traditional lunch, what is something that they can throw in their locker? And that's simple. We can help them with that. We can give them ideas. We can think outside the box, because let me tell you, I have met a lot of health coaches, and all of them, they have this creativity, whether it is to motivate their clients or look at things through another lens. And I think this is where it's so incredibly important for health coaches to really work in the shift work industry to help our people, our shift workers, be healthier. You know, it's critical that they have something that's flexible, something that when dinner doesn't go right, when going to the gym doesn't go right, Or maybe it's something that we're not going to the gym. Maybe we're working on mobility because mobility is where we are. That's what we need to work on. And the last part of this is familiar and accessible. And this is really important. You know, one of the biggest things I've noticed when I was working with corporate health and wellness liked the new and trendy. How many of you that work in corporate wellness have been asked about intermittent fasting, keto diets, some crazy nut that comes from the far reaches of the world? Yeah, all the time. Corporate likes the new and trendy. Well, I've noticed when we're dealing with shift workers, because time is so critical and they don't want to mess with what works, what doesn't, they don't want to waste their time. They want familiar. They don't want to hear about the fancy nuts. They want to know that they can go to Aldi's and buy almonds or peanuts, and that still can be working for them because they want something that they understand. They don't want a diet generally that is complex. They want to know, quite frankly, if any of you listen to my podcast, to eat their effing veggies. They want to understand that being healthy is simple. It doesn't have to be expensive because money, time, all of that is critical to them. So when we have something that's familiar, something that's accessible, that we're giving them food that they can go to any grocery store. Maybe they're a trucker and they really have to eat at Wawa's and love gas stations. What can they get that they can pull in and still make a better choice? You know, a lot of these gas stations right now, they're carrying eggs, yogurt, cheese sticks, fruit, all which can be really healthy. You don't have to have those greasy egg and cheese sandwiches. There's other options. But a lot of times, I'll tell you, one of the biggest things I found is that they don't think those options are viable. Because I'll hear all the time, well, there's really not enough protein in that. Or is that really enough food? I mean, really, a cheese stick? What am I, 12? Yeah, you're 12. Enjoy your cheese stick. Pull it apart like we all do. They are viable options. They just don't see them that way. And that's really, as a health coach, we can really help them see what that looks like. You know, it sometimes is simple as eat what your grandma used to eat. How many of you have told your clients, if your grandmother would recognize it and eat it, they should be eating it? Anybody say that? Because I know Michael Pollan was big in that. Yep, Susan, absolutely. You know, it's one of those things, it's got to be kept simple because simple is going to make them the lasting change. And, you know, one of the biggest things I realized when working with our shift working professionals, I always thought, how many of you have worked with C-suiters and you thought they were the most stressed out people ever? Give me a hell yeah if you've worked with C-suiters and if they've been stressed out to the max. Because I really thought in all my time of corporate health coaching, like the most stressful job was being in a C-suite position. And one of the things I realized is the fact that some of our shift working professionals are so much more stressed out. And not that one stress is better than the other, but I had no idea it was this stressful. Everything to them a lot of times was stressful because it was always trying to figure out a way through something. I had a guy one time, he was a dryer engineer in that plant, that paper mill plant I was talking about. He has gone to 5 different plants because he always follows the dryer. He is one of 2 people in the entire United States that can service this dryer. And because the dryer was built in like 1920s or 30s or whatever time it was built, and it's crazy old, that it breaks all the time. 4 out of 5 days a week, when he is driving home, he gets called back to come back because the dryer broke and the plant was down. And for him, it was about finding a way that we can make healthy simple, that it wasn't adding any other stress. And believe me, we had the conversation, is it even worth it? But how can we make it? Because he's not going to make a choice if he's going to leave his job now but how can I make it a little bit easier for him to be healthier? So then when he needs to make that choice, he can. And that's what we do a lot. We make stuff easy. We make it accessible. We make it familiar, because that's what gets us the results. You know, I am a firm believer health coaches are the missing link to creating an inclusive wellness program that allows everyone the ability to live a healthy lifestyle. And I really feel that lifting up health coaches, letting them know the conversations that need to be had, we can not only build our businesses, but we can support even a broader reach of people. And that's really what this is about. How many of you would love to start including shift worker professionals in your practice? Or how many of you already are? Let me know in the comments if this is something you think you want to go ahead and add. And feel free at the same time, if you want to go ahead and have any questions, feel free to put them in the box and we go through. Yeah, we need to add it. Absolutely, we need to add it. So if you do want to learn a little bit more, I am launching a pre-order coaching course, and it's really going to walk you through what I call the 5 principles of well-being and how to put that plan all together. You can get 50% off by going to my website, or you know what? If you want to connect with me, let's connect. You can follow me on Instagram. You can find me everywhere. I want to hear about you. Feel free to reach out to me, message me, because I want to know how I can support you. And I want to know what you're doing. I am so interested in getting to know other health coaches and seeing what everybody's about and what they're doing. And guys, in the chat, put your information in, because I'm going to save this chat. And I want to get to know you guys. I want to see what you're doing. I think it's really cool. You already you're downloading my podcast. I love it. And definitely follow my podcast. For those of you that don't know, I am Laura Timbrook. I am from Outspoken Nutrition. You can find me on all social medias. Here's my email address, my website. You know, let's have a chat. And I hope at one point we can all meet in real life. So let's go ahead and open for some questions. Do we have questions?
Yeah, everybody continue to put some questions there in the Q&A. In the meantime, too, I'm going to paste a link in the chat box right now, and that will bring you to a form that you need to complete by this Friday. And that form will enable you to get your continuing education certificate. Give you a little bit of time. We'll get it to you by the end of next week, so you have that for your files. But Laura, oh my gosh, your energy is contagious.
Oh, thank you.
Absolutely contagious. And you know what's crazy too is, as we even, for everybody else, like as Laura and I have done our dry runs, you know, I've seen the slides already before, and every single time though, Laura throws in something else at us. And I'm like, dang girl, like just a wealth of knowledge when it comes to this population.
Yeah, I see Amanda Cox has a question. So this session right now was for 1 CE. I am going to be submitting. So hopefully we can get a couple CEs for it. It'll probably be somewhere between a 3 to 5 hour course, because we're going to go really in depth on this and why it's important. I'm basically breaking out my brain and putting it all down on paper. So, and the release date for it is at October 29th. So it's already about halfway created. So we'll go ahead and submitting it to the board. So I can let you know as soon as we get the confirmation on what that's going to be.
Awesome. Amanda would also love to know, how long is the course?
So the course is probably going to take about 5 hours, 3 to 5
right,
hours. We're about halfway done, and it's about an hour and a half, but we still have a bit more to cover. So I'm going to say it's about going to be between 3 and 5 hours.
Awesome. I see a question here from Pam. What are your favorite resources when teaching shift workers how to manage work-life balance or sleep?
Oh my God, I love this question. So if you have not read the book by Matthew Walker on why we sleep, I highly recommend you guys get it in your Amazon carts, because it is mind-blowing. But a lot of, when we talk about shift workers, a lot of shift workers are already familiar with OSHA. It's one of the reasons why I took that, and anybody can take that nursing sleep course. Like, you go online, I Googled it and I found it, and it was mind opening on some of the things that are going on with even our nursing staff, our residential doctors, or the residents. They have, I guess there's this thing that you have to be awake for 30 hours. Can you imagine trying to save someone's life when you haven't slept for 30 hours? If I miss one night of sleep, I am already like losing my head, let alone trying to save somebody on being awake for 30 hours. And it's a big thing that they're trying to change in the medical field.
Absolutely. Eileen says she read that book too, and it was a great book.
Yeah. And I see Jennifer says she's trying to break into corporate wellness coaching. It is so great. And really, one of the biggest things, and I'm going to kind of promote Abaddon Health here for a moment. Sometimes the biggest way to get into corporate coaching is to consult or team up with a company like Abaddon Health, or I teamed up with a company called Health Fairs Direct. That is the easiest way to start understanding what corporate wellness coaching is like. And then from there, you can go out into your own, but it's really easier if you kind of team up with somebody.
Yeah, it's very difficult to be by yourself as a health coach. I see more and more that people are teaming up and being a part of a team. And even as I speak to current health and wellness coaches, those that have their own companies working by themselves, they're like, I miss being a part of a team. I'm interviewing for a role as a health coach with a company because I just miss being part of a team. I feel like I'm on my own island.
Yeah. Oh, absolutely. And you know what, Pam, I agree with you. The 30 hours makes no sense. And the crazy thing is, the reason why it's 30 hours is because some guy from a long time ago, go figure, a guy long time ago.
No judgment.
No. He was addicted to cocaine. And he wore it as a badge of honor that he could do this. Therefore, any resident he was training, it was part of their training just because it was his badge of honor, and it was because of cocaine. Like, that really, and that's still, all these years have stayed because of that. But, for a lot of us, we see that in corporate coaching as well, that, working those crazy hours is like a badge of honor. I can't tell you how many managers I have talked to that tells me that their best employee is, so-and-so because they haven't taken a vacation in 2 years. What? Come on, this isn't good, guys.
No, not at all. Excellent.
Let's see, I'm just going to go through any questions. And guys, too, leave your contact information in here, because a lot of us can go in, even the participants, and they can save information. We can kind of make this like a mini networking thing. There's not a lot of times health coaches all get together. So this is a way for us all to get together and follow each other on LinkedIn or Instagram and see what other people are doing. And I know I contact all kinds of health coaches to come on the podcast and talk about different things. So I'm always looking to network with other health coaches, because I think health coaches are pretty cool.
Absolutely. And really, this is the beginning of the conversation. This is by no means the end.
Oh no, this is really my mission. My mission is really to support these people that work such important jobs that feel like they have been left out. I don't want to hear another person tell me healthy doesn't work for me. No, let's figure it out. Let's burn the box. Let's break the box apart. Let's light the box on fire. We're going to figure this out, because I don't want to live in a world where healthy doesn't work for people.
Absolutely. Absolutely. I mean, it really is. It's such a different, it's a different world. It really is.
Oh, I love this. So you're absolutely welcome. I'm so glad to bring this to everybody's attention and understanding how important it is. And I love all your feedback. And if you guys really like this, I'm going to copy this. But if you want to send me a testimony, I would love to feature it on my website. You can even put your name and your company name on it, and I'll put that on my website. So it's a little bit of advertisement for you. But absolutely, I'm going to save this chat now. I'll save it a couple times.
Yeah.
Just because I always like to save them.
It's almost like you see on websites like women support women, Health coaches support health coaches.
Oh my
We
gosh.
are a wonderful community.
Weren't we just having that conversation about like, you can go to a salon and there could be a street and you have a million hairstylists and they can all be busy. And I know originally when I started health coaching, it felt very much like these are my clients and like you would put them in this basket and be like, no one can touch them, but I don't want that. I want a network of people that really I can live off of. We can inspire. I had a lady on the podcast. Her episode will be coming up the end of this month. She actually might even be on here. But she talks about food allergies and that's kind of her specialty. And she wrote this book, Katie Can't Eat Nuts. And it's great. And I loved having her on the podcast. And I'm telling you, if I ever hear anybody with food allergies and stuff like that, I'm sending her over to her because that's what I want to do. I mean, I want my business to succeed, but I also want everybody else's too. And I think bringing more health coaches into the world, it only gets better.
Absolutely. Heck, I might even send my husband over to you for health coaching.
Absolutely.
It's funny. We were
shift workers set up.
Yeah. As you were mentioning before too, like the blackout curtains too. I was hand sewing blackout curtains for this man because our bedroom's a weird shape and everything. But like, that's how important it is. If I think he just woke up. I hear that someone coming down the stairs. Like, it's such an anomaly.
Yeah.
Yeah.
And absolutely, it's so important. Those little things that, make such a big change. And I know a lot of the night shift get the blackout curtains, but we can do even more. There's stuff. So the red light glasses, so the blue light, red light. So they're blue light glasses, but they have the red lenses. It blocks out, I think it's like 97% of blue light. So granted, you can't drive with them. Don't drive with them. But when you get home, putting them on, we have seen some really good results with night shift workers with the red lenses.
Yeah, and I even saw a study too about when somebody's traveling home, say in the morning, they just worked the evening, so the sun's rising, they got all the rays on them now, they're driving. If they just put on their blue light blocking glasses on the ride home, the melatonin starts to kick in.
Oh, absolutely. And if we can get the ones with the yellow lenses, that's even better,
right,
because it'll be like, I think it's like 40 or 45% that it'll block out. And even something as simple as tinting their windows legally. I know you're in Jersey, so that's a big thing.
Yep.
Legally tinting the windows enough so it's not so much blue light. But yeah, there's always all these little tips and tricks that really can kind of help. Melatonin is another one I've seen that we kind of can cycle through some melatonin, and that could be helpful to really kind of get the bodies to relax. But yeah, that sunlight, man,
we should have medically approved tinted window laws.
Yes. Jersey would never pass it, but yes.
Oh, awesome. Tim just put that he purchased the Why We Sleep book on Amazon.
Tim, you're going to love that book. And I'll be honest, again, I work with a lot of males. I listen to a lot of Joe Rogan podcasts. He had Matthew Walker on. Amazing. And he also had Robert Sapolsky on, which if any of you have ever read the book, Why Zebras Don't Get Ulcers, that's another really good book recommendation. He had him on. And that's actually why I walked in. My husband was watching it the one time. I'm like, why are you watching Robert Sapolsky? He's like, I don't know. I'm watching Joe Rogan. I was like, wait a second.
Wow, we had a couple other people order the book too. Wow, you better get reimbursements from this
really,
author.
I'm going to start having to get affiliate code.
And
actually, I'm dying to get him on the podcast.
Ooh. Marie wants to know too, can you wear those glasses with contacts?
Oh, yes. Actually, my daughter ended up just getting a pair of glasses. And I think sometimes she wears her contacts. You have to wear them over them, but you can actually order your eyeglasses now with the blue light in it. So she wears a lot of contacts, but I have a feeling, I'm totally freeballing this, but I have a feeling that we're going to start seeing contacts with blue light. Like it's becoming like, you can go to Target. I was in Target the other day and they had blue light glasses next to the Advil. I know.
Wow, I'm impressed.
I almost bought them, but I was like, I really don't need this. Yeah, absolutely. The blue light glasses, I would even put them on, just get the non-prescription and put them over. Definitely talk to your eye doctor and make sure, because I don't wear glasses, but make sure. But yeah, blue light glasses have been really, really helpful. And I know a TV I got maybe last year, it actually has a blue light setting on it.
Oh, nice. Yeah, you have
Yeah.
night mode. For example, I have it set that when the sun goes down, my computer, the blue light goes down as well. And by the way, I just have to add, when you were like, but speak to your eye doctor, spoken like a true health coach.
Yeah, we're pretty used to that one a lot.
We
Yeah,
are not
definitely
medical
speak to your doctor.
experts. Please talk to your healthcare provider. I can help you set habits and behavioral goals.
Exactly, exactly. You know, it was funny when I actually sat for the board. That was one of the things that made me the most excited, is where they're like, you refer to doctors. I was like, oh my gosh. Like, I felt like as a health coach, like the school I went through, they were like, doctors are kind of like, and then it was like, speak to your doctor. I was like, yes, you're speaking my language.
For sure. Oh, Linda, you posted, I haven't been, da, da, da. You have been trying to start your practice, but you worked in healthcare for 30 years in different
Wow.
roles.
Oh my goodness, Linda, reach out, make sure you reach out to me on some form of social media. I'm going to save this too, because I think when we have these conversations with people that have worked in healthcare, it's so much of a more powerful conversation, because you get it, Linda. You
Walked in their
get,
shoes.
yeah, you get it. And it's so much easier to relate. I mean, that's probably one of the hardest things for me with manufacturing. I've never worked in manufacturing. I actually came from a software development background.
It's almost like when you look at peer recovery. I mean, there's something to be said for that social support model of peer recovery, like being able to relate to somebody that's walked a mile in those shoes. Those of you that have experience working as a shift worker and wanting to infiltrate working with this population, you have a huge advantage.
Oh, absolutely. And I remember there was somebody on here that was from a military family. Being a health coach for military families, I mean, again, talk about somebody you can walk their shoes. You understand how important, how difficult it is. Because, yeah, I
Absolutely.
mean, it is having that support system, having somebody that fully understands what you're struggling with is so important. And I think for me, when it came to manufacturing, it came to the skilled trades, I grew up in a family of blue collar workers. I still work on Mustangs and we restore cars. So having that conversation was like when I walked into that diesel shop, I was like, in me in my black little dress, I was like, do, 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 my high heels walking into the diesel shop. I think these guys were like, what is this woman doing?
Who is this? Well, we have about a minute left. So if anybody else has any questions, now is the time. Or you can email me and Laura.
Yeah. And if you have any questions, I probably won't respond till Monday because I'm leaving first thing in the morning to go to Virginia. But I'll be checking. Feel free to message me on Facebook. I'll see it. Somebody from my team will see it. And we'll be able to get in touch with you.
For sure.
Now all of a sudden. Good thing I didn't get the hiccups during the speech.
I was just about to say that. And for everybody too, if you have any issues with the form, I put my email address in here. And that's also where your certificates are going to come from. It'll be coming from that email address.
Yeah, this was cool. And I just want to thank Abaddon Health for really giving me this opportunity to speak and bring this to people and really having that conversation, because I think it's so important. And I'm glad so many of you felt like this was really helpful.
Absolutely. And Laura, myself and Abaddon, thank you as well. This has been such an invigorating conversation. You know, we're starting the conversation, we're continuing the conversation. And so with that, we wish you all a fantastic rest of your day. We really appreciate your time and attention. So thanks so much. Be well, everybody.